Scene, Dr. Adams' office. Mrs. Nguyen sits on the examination table, waiting for the results of her annual checkup. Dr. Adams looks at her medical report with a thoughtful expression. The checkup discussion. Dr. Adams. Mrs. Nguyen, I've gone through your test results and there's something we need to talk about. Mrs. Nguyen, oh, is something wrong, doctor? Dr. Adams. Well, your ECG shows an irregular heartbeat, and your blood pressure is higher than it should be. Also, your cholesterol levels are quite elevated. Have you been feeling any unusual symptoms lately? Mrs. Nguyen, sometimes I feel short of breath, especially when I walk upstairs. I also get tired easily. But I thought that was just normal for my age. Dr. Adams. I understand, but these symptoms could be signs that your heart isn't working as efficiently as it should. It's important that we address this now before it leads to something more serious. Mrs. Nguyen, serious? Like what? Dr. Adams. If left unchecked, high blood pressure and high cholesterol can lead to heart disease, stroke, or even heart failure. But the good news is we caught this early, so we have time to take action. Next steps and treatment plan. Mrs. Nguyen, oh dear. What should I do, doctor? Dr. Adams. First, I'm going to refer you to a cardiologist for further tests. Including an echocardiogram to get a better look at how your heart is functioning. In the meantime, we need to make some lifestyle changes. Mrs. Nguyen, I see. What kind of changes? Dr. Adams, we need to adjust your diet. You should cut back on salt, fried foods, and red meat. Instead, eat more fruits, vegetables, whole grains, and lean proteins like fish and chicken. Mrs. Nguyen, that sounds hard. I love salty food. Dr. Adams, I understand, but even small changes can make a big difference. You don't have to stop everything at once, but gradually reducing salt and unhealthy fats will help your heart. Mrs. Nguyen, okay, what else? Dr. Adams, exercise is key. You don't have to do anything intense. Just a 30-minute walk every day can strengthen your heart and lower your blood pressure. Mrs. Nguyen, I don't really exercise much, but I guess I can start walking. Dr. Adams, that's a great start. Also, stress management is important. High stress can raise your blood pressure. Do you have a lot of stress in your daily life? Mrs. Nguyen, yes. I help take care of my grandchildren and also work part-time. Some days I feel exhausted. Dr. Adams, that could be a big factor. Try finding time to relax. Whether it's deep breathing, meditation, or just taking short breaks, Even small moments of rest can help. Mrs. Nguyen, I'll try. What about medication? Will I need to take anything? Dr. Adams, yes. I'm going to prescribe medication to lower your blood pressure and cholesterol. But remember, medicine alone isn't enough. You need to combine it with these lifestyle changes. Long-term outlook. Mrs. Nguyen, will my heart get better? Or is this permanent? Dr. Adams, it depends on how well we manage it. With the right changes, we can control it and even improve your condition. Some people see significant progress over time. But if we ignore it, it could lead to more serious complications. Mrs. Nguyen, I see. Thank you for explaining everything, doctor. I'll do my best to follow your advice. Dr. Adams, that's the right attitude. I'll schedule a follow-up in a month to check on your progress. In the meantime, if you feel chest pain, dizziness, or worsening shortness of breath, call me immediately or go to the emergency room. Mrs. Nguyen, I will. Thank you so much, doctor. Dr. Adams, you're welcome. We'll work together to keep your heart healthy. Take care, Mrs. Nguyen.